Geti makes it easy for people without AI expertise to create powerful AI solutions. When the solution is used to save the world or diagnose rare diseases, even better. And it is always exciting to talk to someone who has actually done it. Dr. Mathieu Bottier is a research associate at the Royal Brompton Hospital and St. Thomas NHS Foundation Trust. Great to have you here. Hi, Mathieu.
Hi, how are you doing?
I understand that you're part of the PCD Diagnosis Center. What is PCD?
Yeah, so PCD is Primary Ciliary Dyskinesia. So it's an inherited disorder, a rare disorder of motile cilia, which are like small structures that are in your lung. And it's a severe multi-system disease. So cilia is essential for the movement and clearance of the mucus, bacteria, pathogens out of your airway. And so the main clinical finding of PCD are chronic lung disease, rhinosinusitis, but also hearing impairments and subfertility.
How difficult is it to detect that a patient really suffers from PCD?
Yeah, so the diagnosis of PCD is quite challenging, and so experts use several types of advanced and expensive microscopy techniques alongside genetic testing in order to find the loss of function and all the loss of structure that are responsible for the disease.
I see. So the doctor has to be an expert, and the diagnosis requires a long manual process, right?
Yes, so the analysis of the microscopy images is quite meticulous. It needs hundreds of cilia to be analyzed, and so it's time consuming, and as you say, it requires skill and experience in diagnostic scientists.
So, life before Geti, you have to be an expert, and it takes hours to fully diagnose a patient. How does life after Geti looks like?
Well, I mean, I have this stat that I quite like, but for patients, for said patients, we need to analyze about 100 of cilia cross-section when we are talking about electron microscopy. It takes an expert between 1 and 2 hours. My Geti model can do the same thing in 1 to 2 minutes. So very much faster.
Interesting. So what is your vision? Be able to diagnose patient quickly and even in remote places where there are no experts?
Yes, this is one of the aim of this project is to be able to share the model in order to bring that 30 years of expertise that we have at the Brompton to centers that are lacking that expertise, especially in a developing country where it's all about finding the fund to do those diagnoses. And so by bringing awareness of the disease, we might be able to actually find all those patients that were missing from area that are not able to diagnose.
That sounds great. And you are not an AI expert, right? How difficult is it to take such a complex diagnostic method and train an AI model to build an automatic system that could execute it?
Yeah, exactly. So I'm a biomedical engineer by training, so a little bit of computing background, but it's very easy because we can just upload images the way you would upload them on social media, and then the system quickly start to learn from a couple annotations. So within, I want to say a couple of minutes, we already have a model that then can be made better and better as we are training it. But it's very easy to get started with.
That sounds really great. I hope many other health institutes will be able to use Geti to cure the rest of the world. If you are a content expert, but you have no clue how to create an AI solution, Geti is a great platform. Please check my other videos to get started. Good luck.